Hello everyone, welcome to today's video. We will dive into an important but often overlooked topic, harmful effects of oversleeping. By now we should know how important sleep is for our health, but did you know that sleeping too much can actually have some negative consequences? In this video, we'll explore what oversleeping is, how it can affect our health, and the common causes behind it. So what is sleep? Oversleeping. Oversleeping is defined as sleeping more than the recommended amount of sleep. For teens, the ideal duration is between 8 to 10 hours per night. If you consistently sleep more than 11 to 12 plus hours, this is considered oversleeping. While it might feel like you're catching up on rest, regularly oversleeping may indicate a sleeping condition or underlying health condition. These include both physical and mental health conditions that can negatively affect your quality of life. Now let's look at some of the physical health risks associated with oversleeping. First is heart disease. Research has shown that consistently sleeping too much can increase your risk of heart-related problems such as heart disease due to the strain it puts on your cardiovascular system. According to Parker 2022, a study showed that women who slept 9 to 11 hours per night were 38% more likely to have coronary heart disease than women who slept an optimal 8 hours. The second risk is diabetes and metabolic disorders. Oversleeping is linked to an increased risk as type 2 diabetes and other metabolic disorders. This is partly due to alterations in sleep patterns, which can have an impact on glucose metabolism and insulin sensitivity, which can lead to the emergence of these diseases. So, next physical health risk is obesity. Sleeping too much can lead to a more sedentary lifestyle, which contributes to weight gain and obesity. The body's metabolism may also slow down, making it harder to maintain a healthy weight. So, last physical health risk is back pain. Spending too much time in bed can lead to or worsen back pain as it places extra strain on your muscles and joints, especially if your mattress is not supportive. A lack of exercise and extended periods of lying can cause muscles to become tight, less flexible, and more sensitive to pain and discomfort. Next, we are going to break down mental health risks. So first is depression and anxiety. While depression can be a cause of oversleeping, excessive sleep can also worsen depressive-like symptoms. It creates a cycle where sleep becomes an unhealthy coping mechanism, further affecting the mental state. So the next mental risk is cognitive function. Sleeping too much can impair your cognitive functions like memory, focus, and decision making. When you oversleep, your sleep cycle can become disrupted, especially the stages of sleep that are critical for memory, storage, and cognitive restoration, therefore impacting your cognitive functioning. Last risk mentioned is mood regulations. Oversleeping disrupts your body's natural sleep-to-wake cycle, leading to mood swings and irritability. Getting the right amount of sleep helps to regulate your emotions and improve your overall mental balance. So now we're going to be going over some causes of oversleeping. Although you may be oversleeping just to catch up with sleep from the night before, oversleeping regularly can be linked to sleeping conditions or use of medications, which you might need to see your doctor for. Some sleeping conditions include narcolepsy, obstructive sleep apnea, circadian sleep rhythm sleep wake disorder, parasomnia, restless leg syndrome, and depression. These conditions highlight how oversleeping is not just about poor habits, but can also be driven by underlying health issues, which makes it important to address the root causes for better sleep health. So next is medications and substances that may cause oversleep include sedatives, cannabis, opioids, psychotropic drugs, hypertension drugs, alcohol, and antidepressant drugs. It's important to understand these factors so that you can manage them effectively and prioritize healthy, restorative sleep. That is the end of this presentation. Thank you for your attention, and I hope this information helps you understand the risks of excessive sleep and highlights the importance of getting a balanced sleep at night.